Hey, Franny, how you doing today?
Hey, Paula, and hello, everyone. Welcome back. We are here for In
Yeah,
Market Courage Health Live show number 2. Wow,
two.
time
Yes.
flies.
And so I know our last one was, what was it, October? And now here it is, January, and we're so excited. It's 2021. And so of course, we're here on the In Market Encourage Health educational series. We're live on Facebook. And so welcome everyone that's watching us. And we've got a great program to bring to you today. My name is Paula Chrysler. I'm the Executive Director of Healthy Savannah, and this is our 7th year of doing this with In Market, and we love the fact that we all encourage health across the entire community here in Savannah. So, and of course, we're doing it differently. We used to do it in person. We had lunch, we had all that stuff in different places. But now, because of COVID, how do you like that mask, Franny? You like that?
Nice. What does it say something?
It does. It says, what does it say? No, I don't think it says anything, but it was a mask that came with it was called the Face Mask Run. But anyway, so that's the reason you see these little footprints. So I thought that would be a good little, for today's show with activity-friendly routes to everyday destinations. And this is, we wear these masks all the time. So I want to tell the viewers a little bit about you, and I might have to read a little bit here, but I know that you're the owner of Guided Surrender Wellness Studio. You're a yoga teacher, a performer, and a writer. You've got your MFA in Performing Arts from SCAD, Savannah College of Art and Design. We love that part. And you have received your yoga training from Apprentice Yoga School based in Houston, Texas, that is. And you do teach yoga and improvisation techniques to guests around the world. And you're also a blog writer. So that's just amazing all the way around.
When you say it like that, I feel that when you're living in it, it's like, oh, but when you say it, I'm like, oh, I'm so amazing.
Well, it's pretty impressive. I mean, really, seriously, it's like, we kind of need that in these days. All of what you're up to, and and of course, what Healthy Savannah's up to. Just in every way, it's just so helpful to be healthy, and everything you're up to helps support people in wellness.
I love that. And I feel the same way partnering and working with Healthy Savannah in this format, because we have a similar goal, which is to spread the message of health, happiness, and joy and wellness to the community, and make sure that not just one person or certain people get to feel that way, but that everyone is able to feel that way and get access to resources to promote that feeling and that livelihood. And so it's all about, I say to people, I'm all about abundance and love. I'm all about the joy and just
absolutely. And so for those of you that don't know about Healthy Savannah, we've been doing exactly what Franny's talking about we're coming up, we're 13 and a half years in to our organization. And what we strive to do is just make the healthy choice the easy choice for everyone in our community. And we know clearly, and this is the space we've been working in forever, around policy and systems change. So everybody has healthy choices. And I know that today's show, we're going to address some of that as well, that you're going to hear some very specifics about, getting out and being active and having those choices available to the entire community. So yes, there it is, exploring activity-friendly routes to everyday destinations. So Franny, I'm going to throw it over to you and I know we've got some awesome sponsors. We couldn't do it without them.
We couldn't do this show without you. Thank you for that great introduction, Paula. I'm so excited to be a part of the team and to be back with you all for show number 2. This is the In Market Encourage Health education series that is live quarterly. It's an online conversation. So we do want to hear from all of you as we communicate and speak, almost like we're sitting at home all together, but we just happen to be on an online format. The format may be new, but this program will continue to focus on ways to improve nutrition, physical activity, and well-being, just like we spoke about before. And so we're all here to introduce and put this back into our livelihood and put this back into our daily conversations, even though this is a quarterly show. Keep the conversations going. But before we start the conversation, we want to first say thank you to all of our sponsors, starting with our title sponsor, In Market, in partnership with Healthy Savannah. Our media sponsor is the Savannah Morning News. Community partners are City of Savannah and Gulfstream. And we'd also like to thank the sponsor of today's program, Center Park Credit Union, a member-owned, not-for-profit financial cooperative dedicated to helping hardworking people save money and prosper. That is one of my favorite words, prosper. So in a moment, we are going to be exploring some healthy walking routes all around Savannah area and having an amazing conversation about staying healthy. And that's why it's important for you to know about them. I mean, did you know that less than half of all adults get the recommended amount of physical activity? And that walking can be the easiest way to reach the recommended amount of moderate intensity. And this is why it's extremely important that we talk about this today. But hey, first, look who's here. We've got Donna Williams from Center Park Credit Union.
Hey, Donna, I think, can you undo your mic while you stand on your head?
Live. So
I got so excited, and then I saw myself only half of me, and I was like, wait a minute, what's happening? So Happy New Year is what I was trying to say. Oh, and Paul, I love your mug. I love it. Everyone should have a mug. You get a mug. You get a mug. Thank you so much for having me on. I am Donna Williams with Center Park Credit Union. We are extremely excited to be a part and sponsor this In-Market Encourage Health series. Brought to you by Healthy Savannah. And again, to me, it's really no brainer, right? I mean, of course, I work with the credit union. We are new to this area, but not to the credit union business. We've been around for 95 years, the oldest credit union in Georgia. But here, we're more of a community feel, hence our name, Center Park, with that play on parcels, because our history is all around postal workers, right? But I have to say, yes, I have to say why it's so important for us to be here and be a part and a sponsor and working with Healthy Savannah. We're definitely going to be doing more. Our social responsibility is around health and wellness as well. Many of you know we've sponsored well over 10 or maybe a dozen gardens, community gardens, and we're talking about getting people back to the basics, healthy in the communities where they are needed, where there's so many food deserts in the area. It's so important. So we're excited about all the work, definitely that Paula and Healthy Savannah is doing, but that we're able to be a part of that in the Chatham County area. And coming up in a couple of months, we're going to be launching our own Center Park Community Garden in that Bonnie Avenue and Durin Avenue area. So it's going to be lots of great things. 2021 is where it's at. I tell you, healthy. So thank you again for bringing me in and being a part of the In-Market Encourage Health series. I'm very excited, and Center Park is too. Please make sure you guys visit us. I'm sorry, I have to say this. In the Pooler Walmart and Highway 17 Walmart, we're actually there, have been since September. Again, about convenience, where the people are, meeting them where they are.
Oh, I love that, Donna. And that is why it's so awesome that Center Park is here to be a sponsor for our speaker for this show, because it partners so well with the idea of staying active, staying connected in wellness through the resources that we already have, like growing our own food, using the community, because health is wealth, and our community has so many things that we can use to be healthy and express that wealth. We just need access to them. And through Center Park's work and the work that Healthy Savannah is doing and in partnership with In-Market today to share that work with everyone, that initiative is being pressed even more forward. So I love that you're here. I love that we were able to get this connection going. And we thank you for coming on today, Donna. And we will see you again around town in the community. Spread that
definitely. Love. Definitely. Thank you again. You're welcome. Happy New Year again, everyone.
Happy Healthy New Year.
Yes. Happy Healthy New Year. Bye-bye.
New Year. Say it right, y'all. All right. Thank you so much. I'm so happy you all were able to see Donna with Center Park Credit Union today. And we have some more amazing people to meet. Before we introduce today's guest, let's have a Healthy Minute brought to you by Healthy Savannah. Here is Nichelle Hoskins, Assistant Director of Healthy Living. Hey, Nichelle, what's on tap for today's Healthy Minute?
Hey, I'm so excited to be here. By the way, Happy New Year. And I wonder, did you guys know that the flu season can run all the way through May?
What?
Yeah, exactly. And most of the time it's just through February. So, but it's still really important to get that flu shot. And I wanted to let you guys know this is, it's not too late. And in fact, it's important because you want to stay out of the hospital. Last flu season, an estimated 400,000 people went to the hospital because of the flu, the seasonal flu. And you don't want to go there because the hospitals are already, they're already taxed. We'll just say taxed, right? Right. So avoid it.
Yeah.
Get that. And if you haven't gotten yours yet, then go to herohelpme.com. They have an exhaustive list of where you can get a flu shot in Chatham County.
Yeah, I love that you said that. Thank you so much, Nichelle. I do believe that there is a need and interest. Sometimes we just don't always know where to go and how to do it affordably. So thank you for sharing that tip. And again, especially with the climate and with changes in temperature, things are staying around longer and having a heyday. And so it's good to know that it can go as far as May. When you're preparing for summer, you could still be vulnerable for the flu. So
exactly. And nothing's worse than like a summer cold or a spring cold or spring,
you're at the pool and you're like, I can't breathe.
Well, I want to echo what Nichelle just said, because herohelpme.com is really the place to go to learn more about lots of services that you can access. But getting the flu shot, which I did, to be honest, the first time this year, because of exactly what Nichelle is talking about. It's just, we absolutely positively need to do it and take care of ourselves and take care of our families and friends.
It's all about prevention. You want to prevent yourself from needing further assistance and help. So you want to do what you can on the daily front. And that's one thing that we can do. Thank you so much for coming on and chatting with us.
I think I'm out of here too. So happy New Year, everybody.
Happy to both of you. Thank you, Paula. Thank you, Nichelle. We also spoke with Donna. Thank you all for coming on and getting us started with today's show. And we'll see you again around the community, Paula. I want to reiterate, I said it really fast, but I really want us all to consider this before we really jump into today's show, that less than half of adults get that recommended amount of physical activity, and that walking can be the easiest way to reach that recommended amount. It is moderate intensive activity that you need to do each week. And we've talked to Don about community gardens, and we've been talking about different ways that we as humans are out here in the community trying to do what we can, what we already have and what we already know to promote the health and the livelihood that we have in our lives. And so we do want to hear from all of you about ways that you are staying active in the community. What are some things that you are doing, and how are we able to have you be a part of this conversation by saying what your thoughts are? So anything that you want to comment, please feel free to jump into the chat and say those things. We want to hear from you, and we may post your comments and pull them onto the stream and on air for others to read. And with that, we're going to be talking about that topic, something a lot of us have been doing. Our topic today is exploring activity-friendly routes to everyday destinations. Let me say that again for the people in the back. Exploring activity-friendly routes to everyday destinations. So this is something a lot of us have been doing more of because we've been at home and we've been trying to still get that physical activity. You might be going a little stir crazy. You might be doing things more like walking and biking. But more specifically today, we'll be talking about exploring activity-friendly routes and how we can integrate those into our everyday activities. So with us, without further ado, we have Armand Turner, who is the physical activity manager with Healthy Savannah and YMCA's REACH grant, and that is racial and ethnic approaches to community health. Hey, Armand.
What's going on, Franny? So happy to be here. How you doing?
Here with you. Nothing but the sun over here. I'm happy and feeling joyous to start a new year off on a good start, spreading the joy. And I wouldn't rather be doing it with anyone than you right now for our second show of In Market Encourage Health Live.
I love the positive vibes. I'm right there with you. I'm ready for this year.
I feel like you have a very contagious energy too. And so I think everyone's going to be so happy to interact with you today and have this amazing conversation, especially about what's happening in Savannah that's going to promote having these activity-friendly walks, these activity-friendly routes outside so that you can get out and to get some fresh air. And when we look around Savannah, we see lots of just wide, shady streets, flat terrains, and the weather is beautiful most of the time. It's a little cold right now, but it's beautiful. And it's great for walking and biking, right? Like,
Yeah, Savannah is like an awesome place to walk and bike. Like you said, the weather is usually nice throughout the entire year. And our squares are like known throughout Georgia,
I
known
love
really throughout the country. And our downtown area is so walkable, but we do have like other obstacles though. Outside of that downtown area, we don't really have a lot of sidewalks.
yeah.
And of course, lack of sidewalks means lack of access for people who want to walk, or people who want access to parks and other of those great recreational opportunities that could exist here.
You're right. And the whole point of today and the mission that we're trying to go forward with is being able to do this, but also being able to do it safely and with confidence that you'll be okay and that you'll have a great experience. Do you know what is happening in Savannah to make routes more activity friendly, such as things for pedestrians and bicyclists?
Yeah, the number one thing I love to talk about that we're doing here as far as creating those activity friendly routes to everyday destinations is Tide to Town. So Tide to Town is the 30+ mile walking and biking trail network that we want to see get built for the entire Savannah and Chatham County. Once it's built, it'll connect all of the neighborhoods and districts within the city and eventually branch out to the surrounding cities throughout the county. And so we've already sort of did a ribbon cutting. You might have seen some photos in the news of us cutting a ribbon at the Truman Linear Park Trail. And so this is the trail that just opened. If you haven't been out there, you have to get out there. And it goes from Lake Mayer all the way up to Durand Avenue. So it'll pass by Scarborough Sports Complex. There's already a ton of people using it. You'll see people out there on rollerblades,
I love it.
On bikes, skateboards, walking strollers, and all of that. We actually do have a video. And
yes, I was going to say that. You're creating major FOMO right now. Like I'm sitting here like I need to be on this trail right now. And so since we can't go there right now and we're inside, we're going to go to your video and have the experience as if we're right there on the trail.
Let's do it. So we're here at the Truman Linear Park Trail. And what better example of activity-friendly routes to everyday destinations than this trail? So about a quarter mile that way, you could get to Jenkins High School. And about a quarter mile that way, you can get to Scarborough Sports Complex. So those are two examples of how you can get to school or a place of recreation. But we want to open this up to be able to get to places of work or to the grocery store or church. So when we build infrastructure like that, that's what we allow to happen. So for people who may use cars or people who do not, they have a means to access locations with ease without fear of traffic or fear of any of the potential threats to pedestrians.
Okay, so there you have it. And Gina Barlup Casagrande says, Armand is a community rock star. And when you see him walking backwards effortlessly on the trail because he knows it that well, he spent that much time there, that community rock star is just in his performance and showing. And I love that you are out there not just talking about activity-friendly routes, but also being a part of it. So people are seeing you on the trail and seeing the walks that you do with Paula for Healthy Savannah. And you live this life, right?
Yeah, me and Paula are out there all the time. We've gone to the Truman Linear Park Trail probably too many times to count. But one cool thing that we do together, and was really one of the sort of, we call it silver linings of this whole pandemic that we're living through, was the healthy walks that we started doing. So initially it started off just as us looking for a means to keep our main group together, our YMCA and Healthy Savannah team, but do it safely throughout, working from home and whatnot. And so we decided that we'd go out to the trail and socially distance while we're out there, be masked up, and just go for a walk. And we started doing it every Tuesday. And then eventually we decided, hey, why don't we invite other people to join us virtually? And so we started live streaming through Facebook Live. And the reception we've gotten back has been incredible. And so we're out there every Tuesday, and we look for different places throughout the county to sort of walk and really introduce the people who are watching to these trails that they may not even know exist within their own neighborhood. So it's been an awesome experience, and I look forward to it every week.
It's been awesome for you, and it's been awesome for us viewing. And I also think it creates this inspiration and this idea of like, I can do that too. Who in your neighborhood could you go knock on the door? I know I have someone who lives across the street, and she's always like, let me know if you'd like to go on a walk. I'm so open. And so I do, and I go out for a walk or a run. I may run, and I, can run at a speed where she also walks beside me. But we can do that in a group, and because it's outside, it's safer as far as being able to make sure that we're social distancing and breathing in free, fresh, flowing air and being safe. And so we'd like to inspire all of you. Please comment in the chat. Let us know. Have you started a walking group? Have you been watching Armand's walking group, and has that inspired you to go out to the Truman Trail? Or what are some other places that people are walking? Are there any other trail options for those who don't know?
Yeah. And you'll see, especially if you've been following us, we found places on Skidaway. We found places downtown on the south end of Savannah. They're really existing all over the place, and you'll find them if you look for them. But of course, we want to continue to create more and more. One of the cool stats that we always talk about from the CDC, who sort of sponsors our racial and ethnic approaches to community health grant, is that 35% of people will walk to work if they live within a mile of that actual workplace. So when we're talking about activity-friendly routes to everyday destinations, it's kind of what we're talking about. If that infrastructure exists, people will use it. If you build it, they will come. And so we want to encourage more infrastructure being built so that people can walk from their house to their job or to the grocery store or to church. And once you sort of mix that physical activity into what people are already doing on a daily basis, it makes it a lot more easier for people to be healthy.
Yeah, and I love that you're bringing that up. It is also about survival and getting to and from where you need to go, while also being able to implement that exercise and that daily amount that we need that takes care of us each week. How much activity do we need, would you say, on a weekly basis to stay? I mean, I've always heard the number of 30 is a recommendation. What do you know about that?
Yeah, so what the CDC recommends is about 150 minutes of what they call moderate intensity activity per week. And moderate intensity could just be brisk walking. So being out on those trails or walking to the grocery store or walking to school every morning throughout the week. If you add that up to 150 minutes, then you're living right. So that's really just about 20 or 30 minutes a day. So it's definitely doable.
Yeah, and you told me, and we had a lovely conversation where we both talked about a period in our lives where I lived in New York, and so I was walking a lot more and taking a lot of public transportation. And depending on where you are, you could be, you could have to walk like 15 minutes, 20 minutes to a train. You could have to walk before you could get where you're going, or bike, or you need that exercise as a means for survival to get to and from work. And you had an amazing story about that as well.
Yeah, so a lot of people may know or may not know, I'm originally from Indiana. I went to Indiana University and I majored in recreation. So once I finally graduated, I got an internship in Denver, Colorado for their Parks and Recreation department. And so I knew I wanted to take the internship, but I also knew that getting there would kind of be trouble for me because I had a car, but it was not a car capable of going cross country through the mountains. It would have never made it. And so what I ended up doing is flying there for that summer. And as soon as I landed, I went and found a bike off of Craigslist. And I had to take the bus system in a city I had never been to, all the way to the other side of the city. And I purchased the bike. Then I had to ride the bike back. And it kind of introduced me to that type of lifestyle, because from that point on, I used the bike to get to work every morning, and I would ride it about 50 minutes, sometimes a little over that, just to get to work 5 times a week.
Oh my God. Imagine the effort that it takes to not only go out, purchase a bike, but then in a new place with a whole new terrain, ride that bike to and from work and get there and actually have energy to do your job that day. Like, kudos to you. And that explains why you do the work that you do now.
Yeah. Because up to that point, I probably hadn't rode a bike since I was probably like 10 or 12. And so And so little did I know, 3 or 4 or 5 years after that, I'll be working in this sort of arena, trying to encourage others to ride and bike more and walk more, and helping others understand that for many, having a car is a luxury.
Yeah.
And that's not something that everybody has access to. And for those who don't, they still need to get to the grocery store. They still need to get to work. And so we need to create that access for those people, because we know the physical activity benefits for it, but the real life benefits of having this type of infrastructure in your neighborhoods and your communities is even greater than that. So it's our duty to create that for our neighbors.
And with that, we actually have a question: why and what are the benefits of health and of having this exercise? We have some data and some statistics that we'd love to pull up to not just have the opinion about it, but to also show you what data shows about this. So Armand, do you want to show us a little bit about that?
Yeah. So the first one, only 1 in 4 adults and 1 in 5 high school students fully meet physical activity guidelines for aerobic and muscle strengthening activities. And so these are our kids. These are our nieces and nephews. And if they're not meeting these standards at an early age, then it's hard to expect them to have those healthy habits going forward into adulthood.
Yeah, and what is it that's happening with in Savannah right now to assist students with getting a little bit more physical activity? We'll come back to this statistic. I'd love to hear you speak a little bit more on that.
Yeah, one of the cool things that we've been working on, and really has been a thing within Savannah for many years now, especially with Healthy Savannah, is our walking school buses. So basically what a walking school bus is, it's a specific school. There are students who live in that neighborhood or live within a mile or so of the school. They kind of get the students together and they walk in big groups during the mornings, and one school lets out. And of course, they're supervised by a volunteer adult. They meet every morning and they walk from the starting point all the way to the school and back once it's done. And the point is, we want to encourage our students to practice those healthy habits early.
Right.
So is especially important with throughout the country. Our lunchtime and our recess is slowly getting more and more reduced. It's important for us and important for our children to be able to get that physical activity early in the morning.
Exactly. And Paula Chrysler has commented and let us know that research, and it's not just Paula, just that this is proven that research shows that it is good for both mental and physical health. And that does not exclude our youth, our children. Mm-hmm. And those who are young and more apt to physical activity also need a push and a drive to get back out there, because technology has changed how we're getting out in the community. We're starting to see that we are having a youth environment that's a little bit more home-based. I don't know if you've noticed that. I noticed with my nieces, getting them outside is like pulling teeth. And so that's a great program to really help make sure our youth are staying integrated into the community.
And we talked about me riding my bike to work all those times. You would think you'd be exhausted by the time you get there and ready to take a nap, but that's rarely ever the case. And most people who do walk and bike to work can attest to this. You get that boost of energy in the morning that oftentimes carry you throughout the rest of the day. So
exactly. Carol Hammock Williamson says, I'm hoping to add biking to my daily routine and walking daily. Carol, we send you love with that. I think that's you can definitely do. And please share with us how you do it and tag Healthy Savannah. And so we can send you some love and support and be your accountability partner if you'd like that. She also said walking school buses is fantastic. And we've also heard Kayla Brown says there are great trails at Tom Triplett Park and Skidaway Island State Park. So if anybody wants to enjoy those for their new daily walks or bike rides. And I love this comment. I want Armand to hear this because it says from Carol Hammock Williamson, even your voice and demeanor is calming, along with your encouragement to simply get outside and walk. And so sometimes I genuinely believe people want to do the best that they can. We want to show up in the world. We just always don't know how. And that's why we have these statistics to show you all what's happening among the world. It's not just you. It's not just you struggling to it's not even struggle. It's we're all trying to figure out how to integrate more healthy activities into our life and how to be more physically active. We have a few more statistics that we'd love to share with you in regards to what's happening on a larger level, so that you can know that it's not just you, and that these are the things that we're trying to work on.
Okay, so about 31 million adults aged 50 years or older are inactive, meaning they get no physical activity beyond that of daily living. And so as we've been living through this pandemic, we've learned that as you get older, the more susceptible you are to possibly getting sick, and how that can lead to even worse sicknesses. So we really want to encourage our older population to be more physically active and do those moderate intensity, easy to do things such as walking in order to get that physical activity.
Yes. And we have former Mayor Otis Johnson here to jump in on the conversation and also speak on these healthy activity routes. Armand and I would love to give you a hello. He says, very informative program. Good job. Thank you so much.
Love to hear from Dr. Johnson. That's awesome.
It is awesome to have every single person commenting and letting us know how you are experiencing this conversation in your life and how you are making it active for you. And as we continue to move through this conversation in our own lives, how can we have those conversations? Armand, do you have any recommendations for things that we can say to others to encourage each other? Because that's a big thing I'm seeing in the comments, is that you're so encouraging. And how can we also take a bit of tea from you and be encouraging to others?
I say when you're trying to encourage others, you really just have to bring it home to them. Related to what they're going through. So basically everyone that I'm working with, and I know they're working from home now, and so they're often sitting in front of their desk all day. Encourage those people to get outside a little bit and start slow with them. Meet people where they are. Don't expect everyone to go out and, maybe walk the entire Tide to Town 30 plus miles, but just encourage them to get out first, and then take those baby steps towards walking more, and then maybe they'll want to bike a little bit more, and then maybe they may transition to wanting to bike to work in the morning one day out the week. It's all about taking it slow and not rushing people or making them feel uncomfortable about improving their health.
Oh, exactly. I love that you're saying that. It's about being kind. And it's about being generous with what we can personally do. Like, I may want to run, but you may want to walk. That doesn't mean we can't go together. And inactivity is something that I think we don't even know is being promoted during times like this, when we have to stay home. We have a slide in our graphic about inactivity, saying that it contributes to premature deaths. And so inactivity contributes to 1 in 10 premature deaths. And so even though we feel this inclination to stay home, and even though we feel this inclination to be inside and to be a recluse, I'm a personal recluse myself, and I have to encourage myself to leave the house and be active. I'll do plenty at home, but it's about getting out that sometimes I even struggle with. And I do teach yoga, and I am in a field of wellness, and even I sometimes become a slave to my own thoughts and become inactive. And so I love that we have that statistic to show us that it's happening among many of us. And even I love that we have another statistic about less than half of the U.S. population lives within 1 half mile of a park. And so that means that you are typically close by a place where you could go walk or be out and be in a safe environment. Sometimes we just need those accountability partners to help us get out there, right?
Exactly. And when we talk about heart disease, diabetes, heart attacks, strokes, all of those are scary words, but they're all real life things that inactivity can eventually lead to. And so we know that being more physically active and hitting those 150 minutes a week can help reduce those scary words.
Right.
So it's important for us to get that other half of those people who don't live within a mile of a park better access to that type of infrastructure so they can hit their 150.
Yeah, Paula Chrysler just let us know inactivity costs nearly $400 million a year in Chatham County, most of its medical costs and worker productivity. And so inactivity is one of those things that slightly creeps up on you, especially as you mature, right? As a certain age, at a certain age, we kind of tap off and remembering and having time, and it's not purposeful. Your work responsibilities get higher and familial responsibilities get higher. I believe it's over the age of 31, we start to find a decline in activity. And I definitely think that has to do with our situational and our circumstantial experiences. We have a graphic about that as well. Only 40% of school-age youth who live a mile or less from school report that they usually walk to or from school. And then we also have one for adults. What do we have? Yeah, nearly 1 in 4 young adults are too heavy to serve in our military, which is interesting to know. And then we have walking and biking as a main form of transportation to those who have no other choice. And about 31 million adults aged 50 years or older. That's the one I'm looking for. Can we pull that one up? About 31 million adults aged
50 years or older are inactive.
Yeah, so that's the main one I'm looking for there. Thank you so much for pulling that up for us. This is where we have to be careful, and we're also talking. We're in a new state now where we've got things happening with the lungs and with breath, as we have flu season and as we have things going on with COVID-19. And the biggest thing is about keeping those lungs active so that we can keep that breath flowing and be responsible for making sure that all the inner workings of ourselves are promoted and able to do their job. Armand, so much.
And like Nichelle said, avoid those hospitals. Keep those hospitals clear. Do what you can on your own, on your end, in the most inexpensive way to avoid going to those hospitals. And this is it.
Exactly. I love that. We have our own ability and our own power to take control of our health and our wellness and our livelihood. And sometimes I think we do forget that. You are in control. And you can do that by continuing to stay active, as we talked about today. Seeing these statistics and knowing that it's not just you, it's a lot of us. And so being each other's accountability partner, saying, I'm going to get my sister more involved, my brother more involved, my friends more involved. I'm going to be encouraging. And when I go out on walks, put it out on live for Facebook. Might be on one end of the trail and someone else might be on the other end of the trail. We actually have another video of you as you are at Lake Mayer end of the trail. So let's see that for those of you who would be interested in that walk.
So we've reached our last stop on the Truman Linear Park Trail. Right now we're at Lake Mayer. Lake Mayer is extremely popular for a lot of people who like to come here to exercise, enjoy the scenery, or even fish. If you take the trail up a little further, you'll get to the Aquatic Center, another recreation opportunity. And that brings us to our main point, connections and access. It's so important for us to provide these access points and connection opportunities because for some, it may be a better chance for them to exercise, but for others, it could be a better chance for them to reach fresh food at a grocery store, their job, or their kids to get to school. We talk about Tied to Town some, and that will create access points and connections throughout the entire Chatham County and the city of Savannah. Thanks.
No, Armand, thank you. Thank you. So with that, what is something that we can call to action for our community? What can we ask what can we encourage others to do so that they can begin building these habits in their life?
Yeah, what I would challenge everyone watching or now or later on when they watch the replay of this is just decide one change that you can make in your daily routine to be a little more physically active. And maybe they'll start with simply watching those healthy walks that me and Paula do every Tuesday. So you can find some locations that you will feel comfortable walking. Or maybe for those who come along a little bit further with improving their physical activity, ride your bike to work one day out of the week. Just make one change for 2021 in your daily routine that'll lead to more physical activity. I challenge everyone out there to try that out.
And the week is not over. Try just even one walk this week, even if it's even if it's just for 15 minutes, if you can only even get out there for 5, just trying to just do one walk this week that allows you to get some fresh air into your lungs and for you to begin this journey with yourself. John R. Bennett says, I signed up for the 52 hike challenge and bought a Georgia State Parks pass to start the new year. Woo, John! I love that. And what a suggestion. What a beautiful suggestion for others. We also have for parents, we have Carol Williamson says, thank you all for all that. Thank you to all that worked extremely hard to have these trail systems begin to appear in Savannah and Chatham County. It is such a beautiful thing to have. And the thing is, the trails aren't going anywhere, right? They're here. They're built. So we need them. Tied to Town says, for parents and other caregivers who want to teach bike safety at home, Georgia Bikes has assembled resources here, and we have a link for you that's also down on the screen so that you can follow that and get more information. We have so much of a wealth of experience that came from Armand to help support us in this journey. I feel inspired to take a walk this week. I have not yet. I am almost ashamed to say it, but I have barely left the house this week. It has been such a busy week, and that's why we said that inactivity, it just kind of sneaks up on you.
Mm-hmm. Take that opportunity to decompress. One of the things I did just this past year, one of the sort of changes I made was to get me and my dog a little healthier. My dog had gained some weight, and so we made the decision that we would walk a mile every day. And so now we walk at least 6 miles a week, just me and my dog, and it's awesome. It helps me decompress. It's as simple as that.
And I love that you said decompress. And we all know there's a lot going on in our world right now. There's a lot of change happening in our world right now. And just a lot of different things are arising that are causing us all to sometimes need to get out of our house, take a break, take a breather, have a walk to just reset your mind, reset your energy. Having dogs is a great way to do that. I am a hopeful 2021 dog mom. I'm still preparing myself to be ready for that journey, and that will also motivate me in a more physical way. So I love that you said that. So with that, this is not something that's just going to help you be more physically active. It's about being mentally more sound and having more mental space and capacity for yourself. You can clear your mind through a walk. You can open up your lungs and feel breath. And I love that all the trees, especially in Savannah, you're breathing in so much beautiful oxygen. And the trails are there to support you if you're in a community or an area where you may not feel comfortable walking out, or you don't have any sidewalks, or you want to go somewhere where you might see people, but you can still stay at a safe distance from others. Hey, they might even see you, right?
Right. You're very likely to see me. You'll definitely see Paula.
Yeah, and Paula. So when you see them, say, hello, I saw you on In Market Encourage Health Live. We're so excited that all of you came out for this amazing show that we had with Armand today. Thank you for your comments. Thank you for interacting with us in this conversation. And most of all, Armand, thank you. We appreciate your encouragement. We appreciate your energy. We appreciate your heart, all the work that you're doing. It is more impactful than I think we could ever find words to tell you. So thank you.
Thank you so much.
Thank you, Armand. And with that, I will let you all go. Please send your love to Armand in the chat. With love. Thank you so much for coming on and being here with him today. We will let Armand go. He's got more walks to plan and more information to get out there about his expertise and about what's being done to create healthy and safe walking routes around Savannah and why we should all be using them. Armand's information is on the screen for you if you'd like to reach out to him and follow what he is up to, along with what Paula is up to. And you can also find out what Donna is up to. You can follow us all on this journey as we inspire and become each other's accountability partners. So up next, we have another In Market Encourage Health show. It's going to be on April 1st, 2021. We'll be talking with Dr. Nandi A. Marshall, Assistant Professor of Health Sciences with Georgia Southern University at, please forgive me for my pronunciation, Zhangping HSU College of Public Health. It is so okay for y'all to write me and tell me how to say that better for the next time. Who will speak on breaking the breastfeeding barriers. She will share the health benefits for breastfed infants and breastfeeding mothers and the racial disparity that exists for many of those mothers and children and how businesses can help eliminate those barriers. So please tune in for our next show of the In Market Encourage Health Education Series. Again, that will be Thursday, April 1st at 1 p.m. p.m. Eastern time right here on Healthy Savannah's Facebook page. While we have broadcasts that are free and open to the public, we always appreciate a virtual RSVP to know that you will be here with us. You can do that at healthysavannah.org/Encourage Health Live. Just click on the Encourage Health link and we'll send a friendly reminder when the show dates draw near. And that way you can always be aware of what's coming up on the agenda and be here for the conversation. And if you'd like to watch today's show again, or if you weren't able to make it for the initial broadcast, it's okay. It will rebroadcast. All of our programs will be rebroadcast, and they'll be available on Healthy Savannah's Facebook page and In Market's Facebook page. And we'll rebroadcast also on the City of Savannah's Government Channel 8. You can also download this program as a podcast from savannahnow.com/podcast. And that way, if you're driving in your car or if you're out on one of the trails and you want to put it in your ears and listen to it, there is a podcast available for you so that everyone can receive this conversation and this information. And you can leave us comments and share how you felt about the conversation and your insights, and let us know, please, how you were all doing on your journey. Again, it's all about community and love. And we are in this together. We are all on a healing journey, and you are not alone on your journey. So please take us up on that offer and check in with us right here on Facebook. Again, we'd like to thank today's guests, Armand Turner of Healthy Savannah's and YMCA's REACH grant, that is Racial and Ethnic Approaches to Community Health. And thanks to you for sharing your time with us today. Please stay healthy, stay well, and we'll see you next time on the In Market Encourage Health Education Series Live. Ciao.